Hey guys, Dr. Rob here today, and I got a very special whiteboard session for you. What we're going to be discussing today is the connection between Lyme disease, thyroid problems like Hashimoto's thyroiditis, autoimmune disease, hypothyroidism, and joint pain. So this Lyme bacteria, Borrelia burgdorferi, is a spiral-shaped bacteria. It's called a spirochete. So think of like a corkscrew, right? And the crazy thing about this bacteria, it's really tiny. It's really tiny. It gets into the body, and let's say a person takes antibiotics. Sometimes the antibiotics knock it all out, but because the bacteria is so small, it hides. And I want to talk about the thyroid for a minute. This bacteria is so small, what it can do is it can get into the thyroid gland. So it gets into the thyroid gland. All these little circles over here, they're going to represent thyroid cells. And the little red dot here, that's going to be our Lyme bacteria. And look at how it just hides in between the cells. To magnify this and look at it more closely, right here, this is going to be two thyroid cells, and this here is the little spiral-shaped bacteria, or corkscrew. And look how it's just hiding in between these two cells. And it's the same thing for the joints. If you come over here and take a look here, we see the joints. The Lyme bacteria will get in between the cells in the joints called the chondrocytes, the cartilage cell, and it will hang out in that space, and it will hide. Will kind of lay dormant. It's a very sneaky bug until the antibiotics are done, and then what it does is it starts to cause problems. It starts to cause problems in whatever tissue it's in. It creates inflammation. And the immune system doesn't like that. So the immune system immediately looks and it goes, well, what's causing inflammation in the thyroid gland? And the immune system is a strong system, right? The immune system is like, if there was a fly on the wall, you and I would just hit it with a fly swatter. We'd go, whap-tap, right? The immune system would take out a shotgun and poof, blow it away. And what we'd be left with is holes in our house, right? We'd have dead flies, but we'd have a bunch of holes in our house. That's how the immune system attacks these Lyme bacteria that hide in between the thyroid cells and hide in between the joint cells and hide in between the nerve cells. Is once they start to get active, they create inflammation in that tissue, in this case the thyroid. Now the immune system starts to attack the thyroid, but it's not really attacking the thyroid. In autoimmune conditions, this is an autoimmune disease, which I'm explaining right now. This would be Hashimoto's thyroiditis. So in this autoimmune situation, the immune system is not really attacking the thyroid gland. It's attacking the bacteria in the thyroid gland. There's a video link I'll put down here below that'll explain some other ways autoimmune diseases develop. So if you want to take a look at that, you can, because this is not the only way. There's many ways autoimmune diseases develop. But Lyme's does play a potential role. So again, it hides in between these thyroid cells. The immune system starts to attack the thyroid. The thyroid then becomes damaged. As the thyroid becomes damaged, it makes less hormone, so you become hypothyroid, right? Then your doctor puts you on Synthroid, levothyroxine, whatever it is, Armour, Nature-Throid. So, but the problem is not the thyroid. The problem is that the bacteria in the thyroid is causing your immune system to attack it. So we have this phenomena that occurs. The same phenomena can occur in the joint tissue, which could lead to rheumatoid arthritis. In the nervous tissue, could lead to multiple sclerosis. These different diseases have a potential connection to this Lyme's bacteria. So if you've ever been bitten by a tick at any point in your life, even if it was 20 or 30 years ago, and you have thyroid problems, adrenal problems, any type of autoimmune disease, anything like that, it's a really good idea, I think, to get yourself tested for Lyme's. Just rule it out. You know, if you're dealing with a chronic health problem, it's good to just rule this one out for sure, because there's so many odd symptoms that are connected with it. You know, you could have joint pain, you could have headaches, you could have dizziness, you could have brain fog, you could have nerve pain, you could have fatigue, right? You could have short-term memory loss, right, where your brain is just not clicking. You could develop adrenal fatigue from this. You could develop thyroid problems from this. You could develop arthritis from this. So there's a lot of symptoms that can be connected to this one particular bacteria. There are different lab testing that you would do to get yourself checked for Lyme's. In a different video, I cover that because it gets kind of confusing. Some things are accurate, some things are not accurate, and it's good to know and understand really what to test for. So I cover that in a different video. And if you're struggling with some type of a health problem or weight problem, I actually put a link down here to my online weight loss and health evaluation, which is a great tool that plays a big step in us finding and identifying the underlying cause to your problem. So So if you need some help, go ahead and fill that out. It only takes about 2 minutes to do, and one of my case managers will call you to go over the findings of your survey. If you enjoyed this video, please subscribe to my channel or share it with a friend, and I will catch you at the next whiteboard session. Thank you. Thank you for watching. I'll see you. Bye.